Stress, fear, or injury may trigger aggression in some dogs. Some breeds have been bred to be more aggressive and may be very dangerous when defending their territory. Intact male dogs and nursing females both may act out aggressively due to certain hormones present in their bodies. Dogs that have experienced excessive punishment, teasing, or chaining in the yard may also act out with aggression. Dogs that may act out with territorial or dominant aggression may hold their heads erect, their ears will be forward, and their tail will be held up. They will make intent eye contact. They may be barking or growling and baring their teeth, and they may advance towards the person or animal that they perceive as a threat. In contrast, dogs may also act aggressively out of fear. A dog who is acting afraid will have his head down, his ears will be laid flat, and his tail will be tucked. Another sign of fear is avoiding eye contact. A fearful dog may also be growling, baring its teeth, licking its lips, or snapping.